I get asked a lot about the new regimes for asthma. This guidance is quite a big change in how we manage this condition, and it can be difficult to get to grips with it because we're no longer using separate preventer and reliever inhalers. This means a lot of the devices that we became familiar with in our training are now no longer being used because the new guidance only uses formoterol containing combination steroid and long-acting beta agonist combination inhalers. With our old regimes, we would use a short-acting beta agonist to relieve symptoms in an attack. The issue with this is the SABA is only an airway widening drug, so it won't manage the underlying process of the condition. It's also so short-acting, it'll regularly wear off overnight when the condition's most active. Maintenance and reliever therapy has been used for a long time, with Symbicort maintenance and reliever therapy first being proposed in 2001. I personally was quite cynical about these regimes because they're a lot more expensive than the old way of managing asthma, but there's a few advantages I've come to appreciate. Every dose of these drugs delivers a long-acting airway widening drug and a steroid to manage the underlying flare-up of the asthma. So this regime has a lower risk of severe exacerbations and hospitalization as a result. One of the hidden benefits of this over the old regimes is in the past we would have to manually step up or down a patient's treatment in a consultation, but with these new regimes we actually don't have to. If we start someone off on the air regime, for example, and they start using it more regularly, they actually will have stepped themselves up to a low-dose MART regime without even necessarily realizing it. To do this safely, we do need to counsel them properly on how they're going to manage this process and encourage them to keep in touch with us. If they're using a reliever dose 3 times a week or more, we advise them to step up to the next level and inform the practice so we can update the record or review accordingly. Once you get used to the new inhalers and the new way of using them, you'll find this guidance simplifies asthma management a lot. Many of the adjunct therapies like montelukast slot nicely alongside this for our patients. A small number of people won't get good levels of control with these regimes, so these people will need a high-dose steroid, and this is delivered using the old regimes of separate inhalers. So don't forget that guidance you learned in training. See you next time.